Okay, we are live now.
With the introduction.
Okay. Shall we start?
Yes, Bilalji, go
Okay.
ahead.
Okay. A very good evening to all the doctors. Thank you very much for joining us. Today's webinar. Actually, our endeavor is to spread awareness about the rabies. We all know that rabies is a very fatal disease, but we can be avoid one appropriately vaccinated. This is an initiative from Kerala Pharmaceuticals. Through this initiative, we serve our society and humankind. The topic of the webinar is dosage reduction strategy in the rabies management and role of novel vaccine. Dear doctors, rabies is the world's first novel three-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch, with more than 40,000 animal bites victims being vaccinated and 100% compliance was recorded, and no case of ADR was registered. With this is my honor to introduce our respected speaker, tomorrow's respected speaker, Dr. Mudassir Ahmed. Dr. Mudassir is a physician specialist associated with Hospital Habak. So now I would request Dr. Mudassir Saab to initiate the talk, and later on we will have a question answer sessions also. All the participants can drop their questions in the box, and we will read out all the questions after the presentation. Thank you very much once again, and Dr. Saab, please continue.
A very good evening to all of you. My name is Dr. Mudassir Majid. I have done my MD in community medicine. I'm presently posted at Habak Hospital. Today's topic we are going to discuss is rabies, a public health challenge in India. As all of you must be aware that rabies is a fatal disease which has 100% mortality. So once a patient gets rabies, is likely not to be cured. There have been, 2 or 3 rare cases. Those patients have been survived. Globally, 59,000 human deaths do occur annually, with the highest in India. Am I audible?
Yes, doctor, you're audible, doctor.
All right.
You are audible. Yes, you are audible.
Okay. So globally, 59,000 human deaths do occur annually, the highest in India. India has 20,000 human deaths a year from rabies. That accounts for 60% of the rabies deaths in Asia, and that's 35% globally. Well, in India, among the 60% of the rabies cases, 91% of deaths do occur in India in rural areas. You must be shocked to know that every 9 minutes, a person dies from rabies. What's the reason? Well, in detail, we are going to discuss what are the reasons behind why there dies a person every 9 minutes of rabies. We are going to discuss the current management of rabies, that's post-exposure prophylaxis. How do we go ahead with that? Post-exposure prophylaxis, what we do is we do the local wound treatment, that's the first aid. We do the active immunization part, that's the vaccine, and we do passive immunization, that's rabies immunoglobulin. So right now we have 2 regimes. Presently, one is 5-dose SN intramuscular regime, and another is Thai regime, that's 22202. There are 4 doses for intradermal regime, and there are 5 doses for intramuscular regime. So the 5-dose SN regime is ideally given on day 0. The second dose is given on day 3, third dose on day 7, fourth dose on day 14, and the last dose is given on day 28. One must be aware that these vaccines are not given in the genital region. They are always given in the deltoid region. What are the current challenges of post-exposure prophylaxis? PEP stands for post-exposure prophylaxis. The foremost and the most important is non-compliance. Non-compliance to what? And then you have the current rabies vaccine. They are all cell cultured vaccines. That's CCV. And we have this inactivated vaccines, which are more than 50 years old technology. So what's this non-compliance? It's regarding the inconsistency in the potency of the vaccine, stability, its availability because of the short supply, and the adverse events. So what do you call a compliance, anti-rabies vaccine compliance? So it has been categorized into three. One is the compliant, another is delayed compliant, and third is the dropout or non-compliant. The compliant patient is the one who has received the full course of anti-rabies vaccine, that is the scheduled dose of anti-rabies vaccine on the recommended days. Say, for example, we have started the SN regime. He has taken all the doses as 0, 3, 7, 14, and 28. So that patient we can call a compliant patient. Another is delayed compliant. Any patient who has completed the scheduled dose of anti-rabies vaccine within 16 days, but deviated from the scheduled regime. Of course, he has taken either the last dose he has taken within the 60 days, or he has missed the last two doses according to that regime, as per the specified time and date. Then you have the dropout and non-compliant. I have come across many patients who are non-compliant or have been dropped out and who were very much, you know, I have come across a patient in Jammu who has taken just a single shot of ARV, and he came with rabies after 28 days. And when I asked him in a detail the history, he said there was a little scratch on my face. It was a category 3 basically. So the blood was oozing out, and he thought it's fine. He has approached to the hospital. He got a dose, first dose, and he was supposed to come on the next dose, but he just didn't turn back. So he had that only one dose. He was, among this category, dropout and non-compliant category. He had taken just only one dose. So those who had taken at least one dose of ARV after animal bite, but not completed all the schedules, or the dropouts or non-compliance. So non-compliance to 5 doses, there has been a proven cause of death. There was a patient, 58-year female. He had a dog bite, stray dog bite. The dog was killed soon. So post-exposure prophylaxis was given. The patient has received only 3 doses. Either it was 0, 3, 7 or 0, 3, 20, 0, 3, and then he 6, 7th, or he has taken the 14th. Another patient, the same, 38-year male. He was bitten by a street dog. The status of the dog was not known. The patient has received 3 doses, just 3, 0, 3, and 7. And another patient, 34-year male, he was also bitten by a stray dog. The status of the dog was not known. He had taken 3 doses vaccine, 0, 3, or 7. So they all landed up into rabies. As we know that rabies is a fatal, at the start of this session, I stated that rabies is fatal. It has a 100% mortality. Once somebody catches rabies, it has 100% mortality. So in these patients, after CSF findings, there were seen that rabies virus is already in the CSF. It has crossed the blood-brain barrier. And those, the first 2 patients were, in the hospital for many days, and they left against the medical advice. These patients land up into aerophobia, hydrophobia, and they finally, die. The reason of death may be due to the lack of administration of rabies, or if they were category 3 patients, uh, it was due to the lack of immunoglobulin or poor compliance to the vaccine. There was one study done regarding the compliance to the post-exposure prophylaxis among animal bite patients. It was a hospital-based epidemiological study done in VMC, Vardhaman Mahavir Medical College, which is also known as Safdarjung Medical College, Safdarjung Hospital, New Delhi. So they had a total participants of 360 animal bite patients. A pre-designed, pre-tested structured questionnaire was already administered for the interview. And what was found is that almost 52% were non-compliant to the full course of ARV. That means they have not taken all the doses. So you can see the problem with the SN regime is like what I came across. The patients forget, the dates, they just forget, or there is some issue regarding the working hours. There are a lot of issues with that. So the compliance with all the five doses is very much there. There was another study regarding compliance to anti-rabies vaccination in post-exposure prophylaxis. This study was done in Bangalore at municipal corporation hospitals. So total number of patients, or the sample size was 215 animal bite patients. So one dose of rabies vaccine administered intramuscularly was on 03, 7, 14, and so it was an SN regime. So all the major constraints were compliance were completed. So still, you can see that the compliance rate for intramuscular was just 60%. So what are the constraints for compliance to complete course of anti-rabies vaccine? That's what was I was discussing. The major constraint for the compliance to the complete ARV anti-rabies vaccine is loss of wage. So somebody is working in a company or somebody is working during day hours. So there's a loss of wage, 47%. So 18% have forgotten dates, like they don't remember the dates, like when was the next day scheduled. Even though whenever we just, make a card of anti-rabies vaccination, we just do mention the dates 037, 14, 28 with the days. So still, few people just forget, and it has been seen that 18%, patients just forgot the dates. And the cost incurred, it's not, necessarily available. All the five doses will be available in the hospital, in the government hospital. So there was like 13% had a cost incurred on that. The distance of the hospital was also one of the reason for 11% patients. And there was, a few children who were bitten by dogs. Like there was interference with school timing, like 11%. So the major constraint here was the compliance was because of the loss of wage. All right, the evolution of rabies vaccine. It starts back in 1885 when Louis Pasteur, uh, did a marvelous job. He was, given Nobel Prize for this in 1905. Uh, so the evolution of rabies vaccine is back to 1885 when neural tissue vaccines were discovered. Then, that was like a first generation neural tissue vaccines in 1885. A total dose of 31 doses were given. Then we had non-neuronal tissue vaccines in 1911, where 14 doses were given, 0.5 dose each in the abdominal region. And then we had the third generation in 1976, what we call as cell culture inactivated vaccines. So the non-compliance led to the evolution in treatment regime from 31 doses to 5 doses and still on. Still on means like we are right now with this Thabi 0373 doses. I'm thinking with time, with artificial intelligence and the latest technology, we might come with, in upcoming years, we might come with a single dose vaccine. Still the best globally is this 3-dose vaccine. Uh, the fourth generation, what we are talking about, is the recombinant DNA technology, uh, whether it's DNA vaccine or a protein subunit vaccine. So let's talk about the meeting the unmet medical need, introducing a novel vaccine with simple and shortened regimen. That's uh, 0, 3, and 7. So this novel 3-dose recombinant rabies is a G protein vaccine, as the rabies vaccine consists of 5, genes. They are the like nucleopeptide N, phosphoprotein P, then it's a matrix protein M, glycoprotein G, and a viral RNA polymerase, that's the L. The most important among them is G and N. They are important for the immunogenicity. Unfortunately, DNA vaccines were found poorly immunogenic. So we are with this G protein, glycoprotein vaccine. First protein subunit vaccine. It has been prepared by VLP, that's virus-like platform technology. First vaccine with 3 doses intramuscular regime, that's 0, 3, and 7, just 3 doses in 7 days. It has a better compliance, it's easy regime, and less visits to the hospitals. So what's this VLP technology? Is a virus-like particles. Virus-like particles are protein complexes that exist as nanoparticles. So VLPs are similar to the native virus particles, but they do not contain the viral genome. So they cannot replicate, but can mimic the viral antigenicity without being pathogenic. That's the most important thing about virus-like particles. That's the VLP technology. So they are capable of inducing a strong humoral, that's innate as well as cellular adapted immunity response. So VLP as a vaccine has been used for this. Clinical study phase 3. The phase 3 study is when the drug is in the market and it's readily available for the patients. So there was a clinical trial done for safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. It was a randomized, comparator-controlled, multicentric phase 3 clinical study. So in this study, they enrolled a total number of 800 subjects and divided into 2 groups. A randomization was done into a 2:1 ratio to evaluate the immunogenicity and the safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers as a regime of 0, 3, and 7 in comparison to a cell-cultured vaccine like Rabipur 0, 3, 7, 14, and 28-day regime, and total subjects were 267. So what were the results? The first and foremost is the efficacy, then the safety profile. So see the seroprotection about rabies vaccine and the reference vaccine. The results were consistent. Whenever there's an introduction of a new molecule or a new substance or a new vaccine in the market, there is always a comparison regarding its. It's never regarded as superior to some other thing. So we see the comparison. The results were consistent across different age groups and genders. So the observed difference 1.5 to 95% of confidence interval, that's 0.18 to 4.17 with pre-specified margin of -5. So here you can see the rabies seroprotection on day 14 and day 42 was done. So the seroprotection from rabies was 99.24%, a little bit higher than the reference that was 97.72. So on 42th day seroprotection day, it was seen 98.69% as compared to the reference, that's like 100%. So among safety, you can see if the p-value is less than 0.05, that's significant. The rabies has the least, adverse events like localized pain. It was like 7.69%. The redness around the vaccination site, it was like 2.81%, and the swelling, it was merely 0.75% as compared to 1.87% to the reference. And what about the systemic adverse events? Not much difference, but yes, with the p-value is 0.1, so you can see the fever is on the lower side. It was just 0.38% in 0.38%. Ear pain was a little bit higher, and headache was seen in 0.38%. There was urticaria, and joint pain and nausea was least with the rabies. So non-inferiority for seroprotection was seen primary. So this is the important thing, that non-inferiority was seen in rabies. So tests and comparators are identical in seroprotection rates, both on day 14, 99.24%, and day 42, that's 98.69%. So the study conclusion was the novel 3-dose was non-inferior to the reference vaccine. So there's less adverse effects compared to the reference vaccine. Novel 3-dose vaccine was to be found safe and immunogenic and was comparable to the 5-dose, what you call an SN regime of WHO pre-qualified vaccine. What is special about this vaccine is that, see, in SN regime or any vaccine, you have to maintain a cold chain. You have to keep these vaccines in 2 to 8 degrees Celsius. So that's, least with this vaccine, this is much more potent. It's stable at the room temperature, and in 1 week you just complete all the 3 doses. That was all from my side regarding this novel vaccine. Thank you.
Okay.
We can go to question and answer sessions.
Now it's question and answer session. So I request every participant, please put your question in the box so that Dr. can answer comfortably.
Well, Bilal sir, I think the session was so interactive that I didn't found any.
Huh?
The session was so interactive that I didn't find any comments in the question answers.
Okay.
It was very interactive session by doctor, and not but last not but at least, but it was thankful to you that you have made our vision very clear toward the 3-dose anti-rabies vaccine. And sir, doctor, I just want to ask you about, like, what are the remedies before taking the vaccination once the person just gets bitten by a dog? And precautionary measures, any precaution?
Well, if say for example, we all are aware that rabies is separated by, most of the time in India, is by dog bites. There are monkeys also, cats are also there. So there is a pre-exposure prophylaxis and there is a post-exposure prophylaxis. Say for example, I'm going to have a dog or a cat at my home. It's better to go for a pre-exposure prophylaxis. That's just for a 3 dose, either 037 or 0721. Now, I land up in, post-exposure, that the dog has already given a scratch, or a cat has given a scratch, or dog has bitten somebody. So the foremost and important thing is, you have to wash the site and do not use irritants. That's the most important thing. Do not use irritants. Irritants retain the virus inside. So the best thing you can advise is just wash the wound with the soap, whatever soap you have available. If it's a Dettol, Lifebuoy, whatever detergent, whatever it is, you have to wash the wound in the running water for at least 15 minutes. That is the first thing one has to do.
Mm-hmm.
The second thing is, take the vaccine as soon as possible.
Okay.
And if it's a category 3, So I forgot to, just I was thinking to categorize these. Basically, we have three categories: category one, category two, and category three. In category one, there is, the skin is intact, there is no bleeding, there is simply licking. Say you have a dog or you have a cat, there is just simply the skin is intact. Uh, there is licking on the intact skin. You don't have to do anything,
Correct.
or simply you can, if you are so much apprehension about it, you can just simply wash it, nothing to do. Then you have a category 2. In category 2, the skin is intact, or there is a scratch but there is no oozing of the blood.
Mm.
Then it's category 2. In category 2, you have to give vaccine and you don't have to give immunoglobulin.
Okay.
Then we have a category 3. If there is a oozing of blood, even a single drop of blood, we call it category 3. In simple language, whenever there is blood, oozing of blood, it's category 3, and the patient has to receive both immunoglobulin as well as anti-rabies vaccine. One important point I want to share is that if somebody has previously taken a vaccine, immunoglobulin or anti-rabies vaccine, he is not eligible to take it again. Immunoglobulin we give just once in life.
Okay.
So there is, immunoglobulins we give just once in life. So whenever we prescribe or advise vaccine or immunoglobulin, we should always ask for the history, whether there is any previous history. Even even though if it's a category 3 and previously the patient has been vaccinated, we cannot give immunoglobulin again because there is always, that vaccine was already given. There is a memory cells in the body that can, recognize this virus again. So all we can have to do is what we are presently, prescribing. Say, for example, there's a dog bite, uh, and that patient has taken the vaccine already 3 months ago. If it's
Yes.
more than 3 months ago, we just give two booster shots. If it's less than 3 months, within the 3 months, then you don't need to do anything. Just go on. Zero, he has taken the vaccine, he's protected for next 3 months. If there is again a scratch or there is a bite, don't have to do anything. After 3 months, he has to go for booster doses, like 0 and 3 or 0 and 7, 2 doses of booster. So if it's like more than a year or more than 2 years, then we might have to start the vaccine again. I find it a marvelous, innovation or breakthrough to have a vaccine which you can complete in a week,
Mm.
because compliance is very important in such
Exactly.
vaccines. Even, educated people forget the last dose. What I came across, I have given, maximum, you can see, during my PG ship, I have given almost a year in anti-rabies section, and I have come across 8 rabies patients who were diagnosed with rabies. I have interviewed them. I have videos of them. I was so keen to see rabies patients. So next time when we just plan a session, I might share those slides with you, and we can have a, you know uh, idea about how a rabies patient behaves, how aerophobia, hydrophobia, all these things. I do have a video of that. I have personally interviewed those patients. So next time we can share just for a knowledge sharing purpose. Um,
Definitely, definitely.
any more
Okay,
questions?
okay, now, okay,
There's no,
uh,
so
I'm
there's no,
audible?
yes, sir. Yes, sir. You're audible, sir.
Yeah, yeah. Okay.
So,
So thank you very much, Dr. Mudassir Saab, for your informative talk. And we truly appreciate your efforts. And last but not least, we would like to inform you that Tabis has won two prestigious awards in the
Yes.
innovation category. First one is 80 India Pharma Award, and second one is Golden Globe Tiger Award. Just the launch of 1 year, this prestigious award has been won by our Tabis. brand. So thank you very much. Thank you very much, Dr. Saab. And I am thankful to all the participants who have listened patiently. Thank you for your valuable time, because we know that you have a very tough and busy schedules. Despite of your busy schedules, you accept our invitations and talk on our products. So thank you very much for that. Thank you very
Thank you
much,
so much.
and
Take care.
have a great evening to all of you. Thank you
You
very much.
too. You all too. Take care. Thank you.
Thank you.
Thank
Thank
you
you.
very much.
Hello, Dr. Tanvir. Hello.